Do women really use it or lose it? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about what really happens to your vagina if you don't have sex for a really long time. And I'll tell you right now that a lot of what you heard is a complete myth, but there are some real changes that happen to the vaginal and vulvar tissues that it is important to understand. So in this video, we'll cover exactly that, and at the end, I'm going to share some science-backed tips to help you maintain optimal vaginal health, whether you're sexually active or not. Really quickly, I am so excited to share something that I've been working on for a very long time. So many of you ask me questions like, do you use it or lose it, every single day in my comments, in my DMs, in our newsletter and our membership, and I just can't get to them all. So in order to allow me to help more of you get the answers you deserve, I created the perfect app. It is called the Better Sex app. It's essentially 12 modules that allows you to get better at sex, and it's customized to whatever you need. Maybe you need help communicating with a partner, understanding what's normal and what's not. Maybe you need help dealing with menopause or erectile dysfunction or low libido. Any of these things, we cover it all. In the app, there's daily lessons, health practices, intimacy challenges, and most importantly, you have me, your AI coach, in your pocket, helping guide you through the entire thing. Check it out today at studio.com/Rena. Again, that's studio.com/Rena. All right, let's start by clearing up the biggest myth I hear, that your vagina will somehow close up or become tighter if you're not having sex. Now, in a normal, healthy vagina, without any skin conditions like lichen sclerosis, this is just not going to happen. Your vagina is made of incredibly elastic tissue. It's basically like a muscular tube that's designed to stretch and return back to normal size. It doesn't shrink or seal shut because you're not using it. However, your tissues can change because of changes in blood flow and muscle tone, and we're going to talk about that. Another really common misconception is that when you don't have sex, your libido is just going to disappear completely. Now, there are, of course, hormonal and psychological factors at play, but if you take a break from sex, you're not doomed to a lifetime of low desire. So now, what does the science actually say? Physiologically, your vaginal tissue is supplied with a bunch of blood flow through these blood vessels. And when you have regular sexual arousal, either with a partner or by yourself, you get more blood flow to the area. Now, this increased circulation helps maintain your tissues. It allows them to stay naturally elastic, lubricated, and ultimately improves overall vaginal health. So when you're not sexually active, you might notice a few changes. Number one, you might notice that lubrication is a little bit different. So normally your vagina produces a normal amount of discharge, but when you have arousal, you get additional lubrication. Now, arousal doesn't always have to be sexual, but ultimately if you're going through periods without extended sexual activity, you might notice that sometimes there's actually less natural moisture, or it just feels different. And this is especially true for women who go through menopause or perimenopause when estrogen levels are declining, because when you don't have enough estrogen around, you don't make as much natural lubrication. Second, over time, the tissue can become less elastic. Now, this is because the vaginal tissues contain collagen and elastin, and these are all proteins that keep the tissue supple. Now, when you have arousal and penetration, it helps maintain the elasticity. Sometimes when people have gone through a prolonged period of inactivity or not having sex, it feels a little bit tighter or a little less comfortable initially. But after you have sex more frequently or more often, it gets more comfortable. Again, the vagina is very remarkable and resilient. The other thing I think to really realize with all these things, especially the stuff we learn from data, is that when you're looking at women who have sex and those that don't, there may be some actual differences between people who choose to have regular sex and those that don't. People who don't may be having some pain or discomfort with sex, and they're just avoiding sex because of it, but saying that there's no real issue. So if you are one of those people and sex is just not comfortable or doesn't feel good, please talk to your urologist, your gynecologist, your urogynecologist, because we can help. Sex should never hurt. Now, this elastic and collagen stuff is more of an issue, again, when you're going through menopause or perimenopause when the estrogen levels are dropping. Number 3, your pelvic floor muscle tone may change. Now, this is because when you orgasm, your pelvic floor muscles contract rhythmically. And this essentially is a sort of covert way to strengthen the pelvic floor muscles. And it helps sort of maintain strength. In fact, I shared a video about how Kegels and orgasms are sort of similar in terms of improving pelvic floor health. Now, you don't necessarily need to have sex with a partner to have an orgasm, or you can just do pelvic floor exercises like Kegel exercises or other sort of exercises that help strengthen the pelvic floor. Now, number 4, sometimes when you're not having sex regularly, it can affect your mental health. And this is because there's some research that suggests you can have less mood, more stress, and even poorer sleep quality when you're not having regular sex. However, this isn't really universal. Many people report feeling fine without having sex regularly. So what matters most is essentially how you feel. And if you're feeling comfortable, you're not having discomfort, you're not having dryness, you're not having urinary leakage because of pelvic floor weakness, you're doing fine. We don't really need to worry about it. But if you are stressed or anxious, this can significantly affect your pelvic floor and lead you to having a high-toned pelvic floor, which can cause pain with sex, which can cause urinary problems, constipation, back pain, a whole host of things. So ultimately, we want to work on reducing stress. And if sex helps you reduce stress, by all means, please incorporate it into your routine. And you guys know, I think that sex is so valuable. Being intimate with another human being, having regular orgasms have so many health benefits. But I think the point here is that if you decide to take a break from sex, you are not setting yourself up for a use it or lose it situation. Sex allows you to get more blood flow, allows you to get more pelvic floor muscle activity, and all those things can be beneficial. However, when you are younger and premenopausal, your body is naturally producing a ton of estrogen, which essentially helps maintain your vaginal tissue thickness, elasticity, and lubrication. So in younger women, it's really a very insignificant issue when you decide to abstain from sex. Your tissues are resilient, adaptable, and they work pretty normally. Once you go through menopause or you're in perimenopause and your estrogen levels start declining, you will actually see changes in your vulvar tissues and your vagina. Your vagina will become thinner and maybe less lubricated, maybe less elastic, something that we call the genitourinary syndrome of menopause. The labia minora will actually shrink and resorb, and you can notice some clitoral atrophy or some shrinkage of the clitoris because, again, of the hormonal changes that are occurring. The good news is there's so much we can do to help. There's vaginal estrogen, which recently just had the FDA black box warning removed because there is no risk of breast cancer, ovarian cancer, uterine cancer, blood clots with the vaginal preparation of vaginal estrogen because it is so minimally absorbed into the body. And almost everyone, even if you've had breast cancer in the past, can get vaginal estrogen. Alternatively, you can use vaginal moisturizers, which are just like the moisturizers you use on your face with hyaluronic acid and other things, which essentially just keep your tissues healthy. And lubricants, which I've talked about ad nauseum on this channel, talking about different types of lubricants, what might be good for you. So check out the videos on that. Now, what can you do if you just don't want to have sex? First of all, you can do pelvic floor exercises. Now, only if you know that your pelvic floor is completely normal. If you have high-toned pelvic floor, you have anxiety, you have other symptoms that I talked about, like urinary incontinence, pain with sex, constipation, talk to your doctor, get examined before you start doing Kegel exercises or pelvic floor exercises. Also, orgasms can help. So even if you're not having sex with a person, having solo sex and having orgasms can help maintain your pelvic floor health. Number 2, maintain your general physical health, right? Exercise improves blood flow throughout your entire body, including the vagina. So you want to include cardiovascular activity, strength training, which is so important for muscular health, and flexibility, all of which can help improve the health of the tissues. And third, of course, consider using vaginal moisturizers or vaginal estrogen, even if you're not sexually active. And fourth, and most importantly, don't ignore symptoms that are bothering you. So if you are having pain with sex, if you're having abnormal discharge, if you feel like you're very dry and uncomfortable, or any of the symptoms that we've talked about today, or anything that's really bothering you, please see your doctor. This could indicate a real medical issue that requires medical attention, or it could be very easily treated. And Of course, always listen to your body. When you decide to become sexually active again, make sure to take it slow, use plenty of lubrication, talk to your partner, communicate with them about what feels good and what doesn't. Ideally, if there is any discomfort, which hopefully there's not, it should improve with some time. Always allow for full arousal and use tons of lubricant. Now, here's the reality for most women. What I see all too often is that women become sexually inactive, not because they really are having an issue, but oftentimes for other reasons. Number one is that they just don't have the same urge for sex or libido that they did before. And this is very, very common. In fact, 40% of women experience low libido. 12% are bothered enough that they require some sort of treatment. And there's a variety of reasons for this, right? There can be relationship issues, stressors, sex that's just not enjoyable, or there may be a real chemical change due to change in hormones, brain chemistry, and we have treatments available. That includes medications like oral medications like Addy or flibanserin, or injectable medications like Vyleesi or bremelanotide, or even off-label testosterone topically for women who are postmenopausal. I've talked about these before on the channel, so check out the videos about these different treatments, but there is help available if you're feeling like you've just lost that part of yourself. If you're a guy listening to this, you want to make sure that you're cultivating an environment of desire. It is very easy when you're in a long-term relationship to sort of just like be fine with the way things are and just sort of do the same thing every time. So it's really important that your partner feels desire mentally. They feel like somebody wants them and they're desirable. And also that you're sort of allowing them to be in a mind space where they can accept your advances. So you really want to cultivate an environment of desire. So that may mean that foreplay starts in the morning, where you're sort of like sending flirty texts, or you're touching each other on the back or on the shoulder, or just reminding your partner how attractive they are. These sorts of things allow desire and arousal to build over time so that when you're ready to have sex, the partner's receptive and excited. Also considering like scheduling time for sex or scheduling time for intimacy, where you guys aren't going out for dinner, but you're actually like gonna hang out and cuddle and maybe be naked together and just enjoy each other without the pressure of sex, but just the goal of being intimate and connecting. And lastly, sometimes women stop having sex because their partners can't have sex, right? Their partners have issues with erectile dysfunction. And we know that 50% of men over 50 will have erectile dysfunction. And so that can be an issue where women just stop trying to have intimacy because you can't have penetrative sex. Now, there are so many things we can do to help erectile dysfunction. You can still be intimate without penetration. I think that's so, so important. If you are struggling and you're watching this and your partner might be having erectile dysfunction, encourage them to see the doctor, because this is an opportunity. When men have trouble with erections, within 7 years, 15% of them will start having trouble with their heart health. They might get a heart attack. And this is because oftentimes erectile dysfunction is because of blood flow issues. And it's the first sign that something is wrong. Bottom line, you won't necessarily use it or lose it, but your tissues will experience some changes, particularly if you are postmenopausal. Sexual activity is great because it promotes blood flow, maintains tissue elasticity, and supports pelvic floor strength. And of course, it improves connection and intimacy with another human being, which is great for longevity. If you guys found this information helpful, please subscribe to the channel. Only 20% of you watching are subscribed, so make sure you subscribe. It's free and an easy way to support the channel. And if you think someone would benefit from this, share the video with your friends, family, whoever you think would benefit. And as always, remember to take care of yourself because you're worth it.